Welcome once again to Mental Health Matters, the podcast sponsored by St. Louis Counseling. Check us out at St. Louis Counseling. That's Saint spelled out, lewiscounseling.org. Once again, my name is Tom Duff. I'm the Executive Director of St. Louis Counseling, also a licensed clinical social worker. So as I always say, I'm a therapist at heart, but I also enjoy the business side as well nowadays. So, of course, this podcast is designed to help break down stigma by talking about mental health in a way that makes it okay, that almost enjoyable at times, where we can kind of sit back, maybe have a few laughs, tell some stories, but at the same time, we are talking about issues related to mental health, emotional health, and things that our society maybe needs to improve on, or our society needs to celebrate as well, too, of different things going on. So, we always try to have a great guest on, and once again we are having a guest that is does some wonderful things within our community as well as our region. Tamara Kenny, how are you?
I'm good, Tom. Thank you.
Good. Tamara is our Director of Advocacy and Community Engagement with Catholic Charities. Catholic Charities is St. Louis Counseling is one of the 8 federative agencies of St. Louis Council of Catholic Charities. And so Tamara brings this wealth of knowledge. Not only does she hold that position, she is also a lawyer, also a social worker, also a mom. I don't know what else to add. There's probably a lot more that you do, but I think those things are enough, right? That keeps you busy a little bit?
It does. Those are the best things.
Good. So, Tamara brings a pretty unique experience to the role. And not only is she trained for this field, but she also got some training as well with some mental health within her own family that kind of maybe brought her to this platform and where she's at today. So first of all, again, welcome, Tamara. We are very happy to have you here. Last week today we launched a podcast internationally because our guest was from Canada. So that's where we're kind of going with. It's an international podcast now. How do you feel about following up with that?
It's a good, tough act to follow.
Yeah, okay. I got that from The Office, actually. I saw an episode where he had an international business meeting in Canada. So it felt right. So, Tamara, maybe let's kind of start with a little bit on, you've talked and you work with NAMI, right? In regards to volunteering as well too. And what kind of brought you to NAMI and wanting to have this passion in the world of mental health?
Well, so as you said, I am a mother to a young adult who has a serious mental illness. And my experience working with him and getting closer to the community of people with serious mental illness is really what inspired this interest that I have. So even before I was hired by Catholic Charities, I was doing advocacy work with both NAMI and with Mental Health America, and had made trips down to Jefferson City to talk with legislators and just really getting connected to all of the advocates across the state of Missouri that were engaging on these issues. Mm-hmm. So it really was, I say that in my social work education, you always hear that phrase, marginalized population. And though I knew what it meant intellectually, it wasn't until my son was diagnosed with a serious mental illness and I became connected with that community that I really understood on a visceral level what it means to be a member of a marginalized population. Mm-hmm. And that's really informed my work with Catholic Charities, where we are working with low-income people who are also clearly a marginalized population in our society. Mm-hmm. So that experience with my son, I think, has really motivated me and guided my understanding of my work with Catholic Charities.
So, hopefully we have millions of listeners and downloading this podcast. We're getting there, right? But, something I think a lot of times we talk a lot about the person that has the mental health concern, the emotional health concern, but then there's this other side that you could probably speak to as one being the parent, caretaker. So I guess when we talk about that stress, that you've probably endured over time, right? Mm-hmm. Talk maybe a little bit about maybe some of the things you've had to realize in parenting somebody that has a significant issue to work on.
I think one of the biggest things that I realized from this experience is just how much stigma there is attached to it and how uncomfortable people are with talking about it. And so it's hard to find people that are supportive of a family that's dealing with an issue like this. People are afraid to even ask about it. It struck me that with my son, I would talk to people that knew that I had 2 children, and while Eli was sick, they would say, how's your daughter? How's Grace? And then there would just be no mention at all of my son. So it really was surprising to us to appreciate what a difference there is between having a child who's experiencing a physical illness, where people are bringing casseroles and sending cards and, visiting and asking after your child, and, we experienced almost the exact opposite of that. So it's just, I think it was powerful evidence of how reluctant people are to talk about the issue and to ask about it. And I feel fortunate that I often want to make it clear to people that when I talk about my family situation, I do it with my son's 100% support. He has told me on many occasions, I am free to share anything about his story and our family story that I believe will help raise awareness and increase empathy from other folks that make it easier for people to live with a mental illness.
Do you think with that stigma, how do we get people to move, in your opinion, how do we get people to move from looking at, physical health, even our when we were talking to Corey Hirsch, hockey, he was talking about this physical injury, you're limping around and people are totally okay with you getting physical therapy for that and everything, but then there's this stigma associated with mental health. How do we get people to realize mental health, physical health, it's all a health issue, right? Exactly. It's just different components. I mean, what have you seen in your view?
Well, one thing I'll say is I think some of it is just, it's a simple intellectual process. I was actually talking with a public defender the other day, and she told me I would be surprised to know how many judges don't believe in mental illness. And I said, you mean a judge doesn't believe a particular defendant has a mental illness? And she said, no, they don't believe in mental illness. And if you just stop and think about that for a second, how ridiculous that is. What you're really suggesting is that every other organ in the human body, at certain times isn't functioning optimally, but that the most complex organ in our body always functions at optimal levels for the duration of the human lifespan. I mean, just from an intellectual perspective, it's just patently ridiculous. So some of it, I think, is that. I think another difficulty with it is that sometimes people that have undertreated or untreated, especially serious mental illness, it's very easy to think of it as a behavioral issue if you don't really understand mental illness. And frankly, people can be difficult. My son can be very difficult when he's relapsed and his symptoms are active again. And sometimes it's easy to lose that sense of empathy and compassion when you're dealing with folks like that. So it really, I think, ultimately is just all about education and helping people to understand. And I think helping people to acknowledge that we all have a state of mental health at any given time. So this isn't just something where we're talking about people with mental illness. We're talking about mental health and where we all are on any given day. And I often think there are days when my son, when his symptoms are being treated, despite the fact that he has a serious mental illness, he's in a better state of mental health on some days than I am.
Yeah, see, there you go.
And that's important, that's an important thing for people to understand.
Yeah, so when people try to understand, well, one, as we pointed out, some people don't even accept that mental health's a real thing, but to help people understand, just because you're mentally ill doesn't mean you can't function in society.
Absolutely.
Because of the stereotypes that we've had over time, right? And through TV shows and movies and criminals. If you're mentally ill, you're a criminal, you're locked up. And there are some very successful people out there coping every day with a mental health issue, and they can be successful. Right. So important to understand. With that stigma component, with your son, did you ever feel, well, let me back up to something else you had said. There's days, right, where you're like, oh my gosh, I've got a lot on my plate. And sometimes that's the mental health system, right, to navigate that system. And we're proponents of, mental health, and we want to talk about all the good things, but sometimes it's important to talk about some of the struggles as well. And so I think you have a kind of unique perspective because you've experienced it on one side, trying to be a parent, navigating through that, and at the same time you're out trying to advocate and make it better. What are some things do you think that we need to improve on, or what did you experience that are some of the struggles, from wait lists to finding psychiatrists, things of that nature?
Well, one thing I'll say, and again, that has informed my work with our low-income clients, is that I'm constantly reminded, as difficult as this experience was for my family, and it was very difficult. My son was hospitalized 6 times, just struggled to find the right treatment plan. And during that whole process, we had very active symptoms, difficulty with school, difficulty with relationships at home. It honestly, I don't think I'm exaggerating to say it almost broke us. It was really hard. But that entire time, I was so conscious of the fact that we really were blessed with resources and access to resources. We had the luxury of time to follow up on information and do everything we could to learn. And I just cannot imagine families like our clients that are dealing with so many other pressures trying to operate within this system. So it was just really difficult. And so much of our system, I think, is a product of this lack of desire to talk about it. There are so many things we could do different. Many of Eli's hospitalizations here were just acute care. It was basically just a very short stay, try to get him to a place where he's not contemplating suicide, and then he's out. But there was never any real comprehensive assessment of what was really going on. And we actually had to go to a freestanding psychiatric hospital in another state, and he spent months there. And that's an entirely different program than what we have access to in the state of Missouri, where the goal is really to really find out exactly what is going on with a person and then develop a treatment plan that's responsive. So I think there are a lot of changes we can make in that regard. And then just increasing access for regular people. One of the things that Catholic Charities has been involved in is the Missouri Child Psychiatry Access Project, which is trying to address the fact that we have a dearth of child and adolescent psychiatrists in our state. We have 84 counties out of 114 that don't have a single practicing child and adolescent psychiatrist in that county.
84 out of?
114 plus the city of St. Louis.
Wow.
So the vast majority of them don't. We have 9.5 child and adolescent psychiatrists for every 100,000 children, and the recommendation is 47. So there's a huge shortage, and it's a shortage that exists across the country. And we know that early diagnosis and treatment is critically important for long-term recovery and stabilization. And the National Alliance on Mental Illness tells us that the average period of time between the onset of symptoms in a child and diagnosis and treatment is 8 to 10 years. And so it makes perfect sense then that the executive directors of our 8 agencies are saying that their adult clients are constantly dealing with poor mental health. People aren't able to access treatment when they're children, and when that early treatment is so important. And then we have adults, that are experiencing poor mental health. So there's a lot of things that we can do better, and I think it all has to start with this willingness for people to talk about it and acknowledge it and be supportive of folks that are struggling with that issue.
Yeah, and of course at Mental Health Matters podcast, right? That's what we're trying to do. We're trying to create this atmosphere where we can just have these conversations. So for you, being that open, right? Did that feel risky at a certain point to you? Like, did you ever feel like, okay, if I share this about my son, what will society think, or how will he be treated? Because sometimes I think we're on the same levels with it as, somebody who from the LGBTQ community who wants to come out, right? And how worried they are about doing that. And sometimes I feel with mental health, it's kind of the same concept. They're very aware of what could potentially happen to them. I guess, did you ever have any concerns about saying, hey, we're putting this out there and you want to do it too, things of that like that?
I don't think I ever did, and I'll tell you what, I think the reason was because immersed in that situation in the moment, there was more anger than anything else that I could see. This person's being treated differently because of the type of illness that he has, and it was critically important to me that he not grow up feeling any kind of shame at all. You have a chronic health condition, happens to be a mental health condition. Many people have chronic health conditions. You have to learn how to manage it, and that's just what it's about. So it was more just this, again, I think just intellectually realizing there's no reason he should feel any particular shame, and I am not going to have it. And I knew that me being open about it and speaking about it was an important part of that.
Mm-hmm.
So
empowering. So I mean, that's one of the things. Have a voice, right? Put that voice out there, and then empowering you as a family member, but the person as well, to say like, it's a condition. It's normal. It's okay. Everybody. And that's the other thing. I think helping people realize they are not alone in this is so important. And when you have, I've heard you speak, we've presented together a couple times, and hearing some of the passion behind that, and you can watch people's faces in the crowd realizing like, you know what? Okay, I can relate to that. I'm not alone. Because I think that's one of the most important things. And just even from talking, I think this is our 7th podcast, right? So hey, congratulations! You're number 7, and hearing people say that what they looked for a lot of times is for others to come out, like with celebrity status, right? So we've seen a lot of people come out in the last couple of years. Really, this past year we've seen. Well, The Rock, has come out and said he went through about a depression. Different singers, athletes. Kevin Love had talked about having a panic attack on the basketball court in an NBA game, and he thought he was having heart issues. And so I think people are looking for that. So I think what you're doing is so important, so important.
Well, and I thought too, I remember seeing bumper stickers that they were doing for people with substance use disorders, and the bumper sticker just said, "I'm in recovery and I vote." And I've thought to myself, and again, I appreciate that I am not the person with the mental illness. I'm a person who loves someone with a mental illness. So there's probably a difference there in how willing some people are to speak about it. But it would be so powerful if we all had bumper stickers saying, "I love a person with a mental illness and I vote." Because there would be thousands of them.
Oh my gosh.
Hundreds of thousands of them.
Yeah.
And, not only, to your point, not only would it do something to educate folks who aren't touched by that issue, but it would create this sense of community and, hopefully decrease isolation among people who do experience that.
So bumper stickers, social enterprise. I'm feeling it. So we could fund some treatment even by selling bumper stickers.
I was even thinking about the other day, we were talking about license plates, Missouri state license plates, and how they have those for different issues. And I thought, well, why couldn't we have those for mental health? I'd pay extra money to have a license plate that had some sort of logo or reference to mental health and how important it is that we address that as a state, and then use that money to fund some of the programs that are so desperately needed. So
yeah, if you think about, the research, depends on which research you read, 1 in 4, 1 in 5 people have a diagnosable mental health condition, right? So that's a diagnosable one. So think about how many other people that are not diagnosed, 1, and then 2, that are just going through some type of adjustment period in their life, dealing with a grief, dealing with a life change, a job change. I mean, those are all components of emotional health and mental health. So, I always just look around the room and I'm like, everybody's dealing with something, and we just have to be cognizant of that as well. And, when you think about just it being a health condition, sometimes our joke around here, and I think we've joked before too, it's like we don't make fun of someone on high cholesterol medicine, right? We don't say, you got, there's no wisecracks about high cholesterol, and people aren't ashamed. Like, yeah, I'm on high cholesterol medicine, my LDLs are through the roof. But how often do you say like, I'm on a psychotropic medication and my manic behavior? You don't hear that because there's still that shaming component as well. So somehow we have to get to swing that pendulum to people can just talk openly about it, and it's the same thing as someone saying, yeah, I'm diabetic, and I need insulin on a daily basis,
And that's another thing that Catholic Charities has been a part of, and I know St. Louis Counseling in particular, but part of it was just sort of a grassroots initiative started by parents of parents who had raised a child with some type of mental health condition, not necessarily diagnosable mental illness, but the kid went through a rough time for one reason or another. But it's called Starting the Conversation, and these parents got together, and the idea was to have a panel of 3 or 4 parents who have gone through this process. We have a child psychiatrist who's there to answer clinical questions, but we just go around to locations in the community, and our purpose is basically to just demonstrate how easy it is to sit around with other parents and talk about your child's mental health challenges. And just to let people see that we don't feel shame, there's nothing to be ashamed about. As part of that, I've often mentioned that we found our current psychiatrist, we just think the world of him, because my hairstylist and I would talk about her children had their own struggles, and Eli had his, And we were looking for somebody, and I was getting my hair cut one day, and we started talking about how our kids are doing, and she was the one who made the recommendation. And I think, too many people would be appalled, like, you're talking about your psychiatry, your child psychiatrist,
your hairdresser,
in a salon.
They are like
with other
therapists.
people.
They are like therapists. Yes, yeah.
But, we don't think anything of it. And I really do believe that that's done a lot for my son, the way he looks at it. We have really helped him develop a healthy way of thinking about his chronic health condition, in a way that's been very positive for him. And like I said, he's very supportive of using his own experience to hopefully change minds of other people.
So as a mom, when you're sitting around that group and you're around similar people, what's that do for you?
Oh, it's great. I mean, it's great to have the opportunity to talk. And whenever I mention it, even in passing in a presentation, invariably there will be at least one other parent who comes up. And some of them I've had parents call and leave messages on my voicemail at the office, and they're very emotional and crying because they have not shared with anybody else, and they finally feel like that I'm someone that they can talk to. So I think we just continue to do that, and we make connections. And some of those people, I brought them into this Starting the Conversation initiative, so we're getting a larger and larger pool of parents that are willing to do what we do and talk about their experience. It's just, it's going to be a long, hard road.
Yes, it is. Just like any societal change, right? That's why we do that.
Absolutely. And then we have legislators at the state level that are very committed to that issue for whatever reason, and they're working with advocates in the community. And so, I mean, there are a lot of things we can do, and there are so many people willing to do those things. So
from an advocacy standpoint, if you're just talking to the general listener, the general public out there, what are some simple things, if they feel the urge, whether it be mental health or anything, that they want to create some change, what would be just some simple starting areas for them to get involved? Besides vote.
Well, that's true. That's the big one. I mean, I think just trying to connect with organizations that are doing the kind of work that you're passionate about and are talking about the things. And if you don't know where those advocates are, like even reaching out to St. Louis Counseling, who's primarily providing the services, but you all know, how to connect people who are more interested in doing advocacy work. And then I always encourage people, I think one of the mistakes that we make when we talk about our legislature is imagining somehow that the people that are down there representing us have some kind of super knowledge about every topic, and to begin to realize that many of them, they're all people just like us, plucked out of their daily lives, who are willing to go down there and do that. They have their pet issues, the things that they're passionate about, but it's very narrow in most cases. And so we have an obligation where there's things that we're passionate about to get to know our legislators, and frankly to provide education to them. And too often I see this very strange deference, as though regular citizens imagine that their legislators are experts on everything, and I can tell you from personal experience that's not the case. It's impossible for them to know everything they need to know to be doing the kind of work that they're doing. So I would just encourage people to get involved, even if it's just a phone call to the office. This is something that's very important to me. It doesn't have to be about a particular piece of legislation, but even if we just had more and more constituents contacting their state legislators, just simply to say, I want you to know that I'm very concerned about the funding for mental health, and I want to see us more committed to that in our state. We were talking at a meeting with Senator Jill Shoup yesterday about some of the statistics, and realizing how our lack of attention to mental health impacts so many things. And one of the things that I know her office is very focused on is suicide prevention and awareness. And we know that 90% of people who die by suicide have an underlying mental illness. And we know that 60% of people with a mental illness receive no treatment in the prior year. And some of that is because of access problems, but some of it goes back to the stigma and the reluctance of people to acknowledge, that they have a mental health condition. So I think even just something as simple as that, making a phone call, and particularly if people are willing to share their stories with their legislators, let them know why they think there's a need for more funding and a need for better access, and any other suggestions that they have.
Yeah, I mean, one time when we were talking, you had brought that up about, remember, these legislators are just normal people, and I had to stop and check myself and go, yeah, we put them on a pedestal, But the reality is, they were trained in one way. How many of them were not trained in mental health?
Right.
Which totally, for our population that we're dealing with, is like, yeah, let's train them, let's help them. So no, that's really good feedback. Really
and you
good
only
feedback.
have to think about yourself. I think about myself. Imagine if I went down to Jeff City to represent a district. People would be bringing me bills on agriculture
Yeah.
and banking and law enforcement.
You're not an expert in all those areas? No?
No.
No? Okay.
And just as an experiment, not too long ago, I took the first bill that was filed in the House last legislative session, and then every 100th bill after that, and just wrote a brief summary of what the subject matter of that legislation was, just to demonstrate to people the incredible diversity of things that are going on down there. So if you have listeners that are passionate about mental health, they should share that passion and what they've learned and what they know with their state legislators.
Awesome. Well, we are here today with Tamara Kenny. Now, Tamara, this is our first remote broadcast on Mental Health Matters. So you're the first one, maybe the 7th overall podcast, but you're number 1 on the remote broadcast. We're here at our St. Louis counseling offices. But it has been an awesome conversation with you today. I think your ability to bring the passion from experiencing, 20 years of being the mom of somebody that needs some help in certain areas of his life, to being an advocate with NAMI, to going to Jeff City and trying to knock on some doors and make some change. So once again, Mental Health Matters has had another great guest today, and we are very pleased to have had you part of that. So hopefully next time we will continue to bring advocacy forward in all that we do with our future guests as well, because that's what it's all about. It's about breaking down stigma. We will continue to explore future topics. And from here, I want to say thank you, Tamara.
Thank you, Tom. And I should add, too, if folks are out there interested in getting specifically engaged on issues around mental health, and particularly as it relates to low-income people, we are always looking for folks like that at Catholic Charities, so they can reach me there, and be happy to see how we can help people get involved in this important work.
Awesome. You can find a link to the Catholic Charities website on our St. Louis Counseling page, but also the Catholic Charities webpage is www.ccstl.org. Say that again for me one more time.
www.ccstl.org.
All right, very good. Thank you, Tamara, and we will see you on the next episode of Mental Health Matters.
This has been Mental Health Matters with Tom Duff of St. Louis Counseling Services. Check out stlouiscounseling.org for more information.